focus like a laser on what good you can do in a given situation. If you focus on a lot of the other stuff that goes on, that distracts you, pains you, and doesn't allow you to think clearly. My job during HIV was to run an institute to develop drugs that would be life-saving for people, both for treatment and prevention. I did that at the same time as I was taking care of patients, all of whom were dying. If I let that specter of darkness essentially envelop me, I would not be able to use whatever talents I have to lead an organization that developed the drug. So you've got to screen out the stuff that's going to get in the way of what your main purpose is. But you got to decide what your main purpose is. And it varied. It was different what I did with HIV/AIDS than what I did with Ebola, than what I did with Zika. And it was very complicated with COVID because on the one hand, my day job was to help develop the vaccine that ultimately saved millions of lives. And my other job, which was also a day job, was to try and communicate with the American public what they need to do to keep themselves safe. Now, the hooker in all of that is that that happened to occur in a country, our country, that was going into a period of profound divisiveness, which really got in the way of a coordinated public health response. And as you well know, that in trying to be truthful with the American public and tell them what works and what doesn't work, that I became a target, a very, very significant target, and a lot of ad hominem attacks, which really were very unfortunate. And even in that regard, the way I dealt with it was just focus on what my job is. And my job is to help preserve and protect the health of the American public. And what everybody else wants to throw at me, so what?
Yeah.
The anti-science approach towards climate change, I think, is finally losing out when you look at the extremes in weather that we're seeing. I mean, you have to be asleep not to see what's going on with climate change. When it comes to infectious diseases, there are major impacts. I mean, just the range and duration in which vectors, be they mosquitoes, or be they ticks or what have you, that would not survive for periods of time at a certain elevation or in a certain climate, is going to make vector-borne diseases. The increase in water level in floods leads again to the emergence of diseases that were very, very uncommon or rare. So climate change is going to have and is already having a profound effect on many elements globally. Infectious disease we're starting to see is clearly one of them. When you're dealing with a static, unchangeable situation, and you hear one thing, and then a month later somebody tells you something else with no new information, that's flip-flopping. When you see something now that's evolving over time, and you have the scientific and public health community trying to say, this is what we know now in January of 2020, so we should do A, B, and C. Then in July of 2021, when you have your fifth variant and you have a lot of other knowledge about it, you say, you know, now we think you should be doing this. What doesn't get translated is that science, by its nature, is a process that's self-correcting, that you give an information on the basis of what you know now. If the information changes the way it did repetitively with COVID, if you're true to the science, you will change your recommendation, your guideline, what you tell the public. Unfortunately and understandably, the public doesn't look at science that way, because the biological sciences is a little bit different from the mathematical sciences. Let me give you a simple example. In January of 2020, 2 + 2 = 4. In March of 2024, 2 + 2 still equals 4. But the virus and what we know about it, its transmissibility, its aerosolization, herd immunity, all the things that change, they change because information changes. So if we were dealing with a static situation, there would be a lot of trust in science. So what we've got to do as a society, maybe by trying to make people more science literate, is to understand that science is a process that provides you with information, and you make your decision based on the information that you have. And it's not something that's immutable. That's very difficult to get across on a broader scale.